JC24-7.
Welcome to JC24-7 as we continue our discussion on issues surrounding women. Today we look at the woman and her sexual health, and we have invited in studio a nursing instructor at the University of the Southern Caribbean, and she is none other than Janice Noel Archer. Thank you for taking the time to be with us, Mrs. Archer. And we want to get right into our discussion because we'll be looking at STDs and STIs, sexually transmitted infections and sexually transmitted diseases. What are the differences, or what is the difference?
The difference between STIs and STDs, difference is that an STI is where the person has the causative organism in their body.
Right.
May not necessarily, show up any signs or so. But the STD is when, yes, you have the whatever causative organism, and you also have the disease, where you would have the signs and the symptoms, and you would need treatment at this time. Yeah.
Would gonorrhea and syphilis and chlamydia fall under STDs?
Oh, yes.
Okay.
There are many. There are many different
I don't hear much about those diseases. Are they under control? Are they extinct in Trinidad and Tobago?
Oh, I just wish they were extinct. Because long ago, we heard about 5 or 6 of them in Trinidad. But today there are over 30.
Over 30?
Different types, yes.
Wow.
It's now under the category, it's categorized under as
Wow.
30, over 30
Wow.
different types of diseases, and
Right.
that's worrisome.
That is worrisome. Among the 30, which ones are most prevalent?
Oh, yes. Well, the HIV, which we hardly hear of these days, but it's still there.
Okay.
Gonorrhea, syphilis, chlamydia,
Right.
herpes,
Okay.
HSV2, and we also have HPV.
HPV.
Yes,
Okay.
those
okay.
are the main ones we...
Very briefly, what are some of the signs and symptoms of some of these diseases?
Okay, well, like gonorrhea, right, it's a purulent discharge or a pussy discharge
Right.
that comes especially from the males. Women, unfortunately, they many times don't know because of our anatomy, because of our body. Sometimes, women are always moist down there, so that even though they have an infection, they may not know.
Wow.
So many times the male partner who would have the early symptoms, sometimes within 2 days
Right.
to 5 days,
Right.
they might see this discharge, but there might be a burning
Right.
as they pass urine.
Right.
And so they would seek medical, attention.
Okay. So,
And then they would tell their partner, because as they come for treatment, a letter will be given to them to bring in all their partners.
okay. So chances are, if a woman is promiscuous, she can have it and spread it to several guys, several of her partners, without even knowing it.
Oh yes, women or men, anyone who
Okay.
is promiscuous can be spreading, well, not gonorrhea alone, there are others.
Okay.
Yeah.
But I'm speaking specifically about a woman because you are saying that women can have it without knowing it.
Yes.
So she can unknowingly pass it on,
Oh yes.
as opposed to a man who may know he has it
Yes.
and knows that he's passing it on.
Right.
So of course, we will want to advise women to manage their sexual life.
Oh, well, it goes across the board for everybody,
Right.
well, especially women, yes, because of how our anatomy,
Right.
we are recipients.
Right. Okay.
We are like reservoirs. So whatever we get into our body,
Right.
it tends to become worse, and
I tell you.
yes.
Okay, how does it impact the body? Like if you're talking about herpes, for instance, having contracted the disease and you know you have it, what are going to be some of the signs that will be manifested?
Well, herpes is manifested by blister-like vesicles, water, like a water bladder.
Right.
So you may have one or you may have a few. But the thing about herpes, it is painful. It's very, very painful. And then when they burst, they might come into one big sore.
Right.
But it's painful.
Is it localized blisters or does it spread other parts of the body?
It can't spread to other parts of the body, especially it's highly contagious.
It is.
Yes. So therefore, we always advise people as they apply whatever treatment, what a lotion or whatever, to use gloves or
Okay.
something.
Oh, is that contagious?
Yeah, because they can, allow the infection to go to the other parts of the body.
Okay. So when you say infectious, in terms of if you touch and you spread it to other parts, simply
Yes.
that's how it's spread. As simple as that.
Right. And the thing about herpes, you hear the talk about use condom, use condom. Condom covers the penis in a man.
Okay. Yes.
And in herpes, you can have the vesicles or the little bumps,
Right.
other areas that are not covered.
Covered. Right.
Right. So in sexual encounters, you have skin-to-skin contact touching.
Right.
And whereas the condom could be used, they can still contract it because the other areas are the ones that were infected.
Already, I'm sure some people are turning up their noses because they're hearing these things, perhaps for the first time. Is there hope? Can these diseases be treated or infections be cured?
Well, there are some sexually transmitted diseases that can be cured, like the gonorrhea. We have medication specific for that, and they can be adequately treated. The syphilis, which is one that is very, very important, we have a lot of screening for that. It can also be treated, right? And we have others, that chlamydia and whatnot. But those that are caused by virus, those cannot be cured.
HPV.
They can be treated and controlled.
Uncontrolled, okay.
But they remain, they said it's like a man's best friend, never leaves them.
Oh, my word.
Contract it.
All right. And that's interesting because it means that once you have that viral infection, you're going to be friends for life, as you said.
Yeah, it remains with you all the time. Okay. And at certain times it will erupt, it will become active, and then it will be dormant sometimes.
What will cause that?
What? Stress.
Oh, okay.
If you're under stress, your immune system is weakened by any reason. For any reason, you can always get an eruption of.
So while it's dormant,
HPV
is it that you are aware it's there, or does it have any effect upon your body while it's dormant, even while it's dormant?
No, well, once you contract it, you have it, so you know that you are somebody, who has acquired the, especially herpes, you know that it would never leave you.
Right.
But there will be times when you will not see these blisters coming up. You will see there are times when there will be none, but the person knows.
Right.
So that is why counseling is that their partners should be told. It's unfair,
But are there chances? I mean, I know, from medically speaking, I agree with you, but are there chances that a person may actually forget that because there are no signs or symptoms being manifested, I might very well forget, hey, maybe the Lord has healed me. Maybe I'm better now, so I can continue. Do you have cases where people think that way?
I know I met one woman who had HIV, and she went to her pastor, and she was sure she was healed. So she came to repeat the HIV test. And I still counseled her, like if she could be.
Right.
And when the result came out, she was still positive. She was distraught. She was disappointed.
I can imagine.
We know God is able, but still, He does what He wills.
What about the ratio between male to female? Could you safely say that more females contracted than males, or vice versa, or there's no data to really substantiate?
Well, because there are more women in the population.
Okay.
Yeah, everything, you always have more women infected. And even because of, as I said, we are like the reservoir, we really get infected more easily than men.
From your experience, and you have been a nurse for over 35 years, I suppose, what's the trend these days? Do you see children, do you see young people, do you see teenagers contracting these diseases, these infections? Yes. And how young have you seen them?
Yeah, on a lesser scale, we have minors coming in sometimes because we have a lot of incest, we have child abuse and all this. And once one of these those person who attacked or abused a child is infected, the child would get it.
No.
So these people, we have to test them. Yes, we have seen young minors coming in, all 12, all ages, sometimes younger.
Wow.
Yeah.
Wow.
And that's the state of the country now.
And to contract it, all you need to do is have sex once.
Well, right. Not even sex alone. You can just get close, some of them.
Wow.
Some don't penetrate. Some just touch up, rub up, whatever.
what about, and I know we're not discussing this now, but people have also gone the way of oral sex. Can you contract some of these diseases orally?
Yes.
You can.
Yes, because especially gonorrhea, right? Many people have it in their throat because they love oral sex.
Wow.
And then they would transfer it to the female.
Okay.
Or to the
What happens to their
partners.
throat when they contract it?
But we tell people in the clinic, be honest.
Right.
Reveal your sexual practice and preferences because they can check your throat, do a throat swab, and the same way we do the swabs for the other area, the penis also, or the vagina, we would do that. They would do that swab and they would identify the causative organism.
But does it have any effect on their throat? Is it that they don't speak well? Is it that there's some irritation or something?
Some people don't know they have it. They're walking around with a long time and speaking well. It's only according to if it really injures or go into the tissues. But other than that, sometimes it's just by the part, whatever they might have to, like most times it will be as people who have been having sex with different partners.
Right.
So somebody would get treatment.
Is it therefore that you can have gonorrhea in your throat and not know it?
Yeah.
Okay. So the question of testing comes into play.
Yeah.
How often or should somebody be tested once they have concerns? Because if I don't know I have it, then I continue to, my behavior doesn't change, my lifestyle doesn't change, and I continue to spread it, if you like. How do you advise people in terms of testing?
Well, usually people won't just go in and say, well, I had oral sex, and only very few people. But because sexually it is transmitted to our next partner, somewhere along the line, that partner would go for treatment, and there's a certain system where you have contact tracers.
Right.
These are people who would give the person slips to give to the partners, and so it would go along and get to that person eventually. So they are asked to come in, and if they don't come in, they will go and find them.
Okay.
Yeah, because they need to be treated.
Okay.
And
the testing is purely blood testing?
No, for gonorrhea, it is a swab.
Right.
Right, they take a swab with smear and culture, where they grow the organism, or they look under the microscope and they put a certain acid and they check and they would see if they are infected.
I'm here with Janice Noel Archer as we continue our discussion on the woman and her sexual health. It's very sensitive, very intimate, but very necessary. We'll be right back as we continue our discussion. Stay tuned. I'm here with Janice Noel Archer as we enter into some very intimate stuff concerning women, the woman and her health. We'll be looking at STDs and STIs. Mrs. Archer, our last session you were talking to the whole question of testing and women managing their health. I also want to veer the discussion in the direction of the pap smear, because we are told that women must engage in this exercise. Yeah. How often and why? Why is it necessary?
Okay. One of the sexually transmitted diseases is human papilloma virus. It's caused by that, genital warts. Okay. Right? And this causes 99, a little over 99% of the cervical cancer in women. Okay. So therefore, we encourage women to ensure they do their pap smear annually or according to how it's recommended by the clinicians. Right. Because if they have seen anything, they might ask them to come in a little more frequently and they can deal with whatever is the problem and prevent it from developing the cancer. As they see the changes that occur in the cells there, they have different ways to treat it. Okay. Yeah.
So you are reaffirming that there is a direct link between HPV and cervical cancer?
Yeah, research has shown that.
That's it. Okay. Yeah. Is cervical cancer high on the list of cancers that women contract?
Oh, yes.
Okay.
It's about, in women's cancer is breast and cervical. Wow. They are the leading cancers.
Right. Even in Trinidad?
Yeah, in Trinidad. I'm sure many of the viewers may know somebody.
Or may themselves have it.
Oh, yes, or may have it themselves. Right. And they have known someone with cervical cancer. Okay.
Speaking of which, having contracted it, some people might be thinking it's a death sentence. Are any of these diseases or STIs or whatever virus we may have life-threatening?
If not treated.
Okay.
If we don't get these things treated, it can become a threat to our lives, right? But with, screening and with so much education out there, although there's a stigma attached.
Of course.
When anyone is ill or have anything wrong with those areas, the genital areas, people feel very ashamed. They don't want to discuss it. They don't want to go to the doctor. But now we have treatment available even for patients with HIV. Right. Long time, HIV was a death sentence, right? It was depicted by a coffin and a skeleton. Right? But now there are the antiretroviral medication drugs that are available that HIV patients are getting in Trinidad free. Right? And many who were sick on the dying bed, we have seen recovered and started to go back to work. Right? So we are encouraging people, go and do tests. Go and do tests. Take away the pride, put it away. There are many opportunities for screening, sometimes at health fairs. There are different areas in the clinics, the private physicians, and where they can have it done. And plus, there's the sexually transmitted disease clinics situated in Port of Spain and in South. In Port of Spain, it's known as Queen's Park Counseling Center and Clinic. Right? It was around the Savannah in its old building. Now it's in the Port of Spain Hospital.
And
they can find it. Right now. Well, that is where it was relocated because of the building they had to move from. And in South, it is down there by the old Ward 17 building. And people can go there and they can get these things. They can do different tests, especially people who want to get married. The partners both can go and do as many tests as they can. From the government standpoint, they are not able to do some of the expensive tests. But there are private labs in Trinidad that will do the more expensive tests. So people can go and inquire and try and make sure that they are entering into relationships where they are safe.
Speaking of relationships, I'm sure you would have encountered young ladies who has contracted the STDs or STIs, and they want to date. They're still young. They are now living with the STDs, and there's no longer a death sentence, as you said. How do you advise them? Do you encourage them to tell their partner upon entrance into a relationship during the relationship, or do they simply keep it on the down low?
Well, for love of that person, they're supposed to really tell them. They're supposed to. With love, love conquers many barriers. We have seen people who, because they have loved the person and are involved in the people so long, they continue with the relationship. They even go into marriage with them. But there are some precautions, They would have to use their condoms. They would have to, be careful. And if it is one of the virus, like the herpes, they'd have to, make sure when the person has the infection, when it flares up, they abstain. Abstinence, I must say, comes in very important.
Okay. And before we get into abstinence, the two persons now are married, happily married.
Yeah.
Do you still encourage them to continue using condoms?
Yes, especially with HIV.
But they're happily married and they both have HIV.
Yes.
Should they still use condoms?
Yes.
Okay.
HIV comes with different strains of the virus. And so we encourage them not to reinfect each other again.
Right.
You want to try not to be infected, get any additional infection.
Okay.
And you want, the best health for that person.
Okay.
So we encourage, even though both partners are positive for HIV, they should use condoms.
Wow. All right. So now we learn that the STDs can be treated, they can be managed, and you can live with them.
Yeah.
They're no longer a death sentence, but some of them you will stay with you till death do us part,
Yeah,
without necessarily causing death. But the lesson is clear. You will want to advocate abstinence before marriage, before knowing that your lifelong partner is going to be a lifelong partner. You want to advocate abstinence. Do you subscribe to that?
Yes. As the Bible stated in the 10 Commandments, we are to avoid sexual sin. And as we know it, sex before marriage is a sin. And many people reap the consequences of disobeying God. So it looks like...
But we love each other. And we are going to get married. Why should we still abstain?
Well, if you want to obey God, you will. Okay. God has made a way for all of us. He has made a provision that we can be overcomers, even sexually. We see, nowadays, it seems like many people have no control. But we have to cry out to God.
Amen.
All of us. Amen. Even pastors, sorry to tell you.
No, don't be sorry, sister. Yeah. We need it more than you think. Right.
So we need to depend on God. We have to be wise. The Bible says, be wise as serpent and harmless as dove. We don't go and take chances, go into compromising positions and expect, saying, I can manage myself, I can take care. We have seen even lately of circumstances where incidents happen where people didn't want to get involved, and so they said, it's alleged. They got involved, and it's causing problems. So as Christians, we have to have God give us that divine, that other sense where we can, He can direct us as to what we should do, where we shouldn't go.
So you believe there must be some higher force beyond, higher power beyond your humanness to be able to control you.
Of course.
And determine how you go and what decisions you make.
Yes.
Especially when it comes to a lifelong partner.
Yep.
Good. Before we close this session and this program, there might be somebody who's listening to you who's experiencing some challenges, either in self-control, one, and they are scared because they think, based on what you have just said, they think they may be a victim. I am saying victim loosely, but they may be one of those individuals who may be susceptible to STDs or STIs, and they are scared to death. Should they be scared to death? And if they shouldn't, what would you tell them?
Well, being scared won't change the situation. So we have to just act on whatever we believe or we think. We cannot just be scared, right? We're supposed to do whatever tests we can do, right? We need, as I said, it might sound like I'm saying it too much. We just have to put our trust in God. We can't do it alone. And even though we are infected, God is the great healer. He could control. We may not never get healed, but we may be able to live as healthy a life. You know, we may not always be getting, you know, like every month, getting the flaring up of whichever disease it is. God could help to put it for years, and you never had an eruption, and that will be great. So we just have to say, God, I know I have, you know, messed up, and you are the great healer. I'm sorry. You ask for forgiveness, and you want him to take care and control. And I can tell you, God will control, and he would keep you as healthy as you can. But you have to keep your end of it. Beautiful. Don't go and be promiscuous again and say, well, can't help it. Beautiful. It wouldn't work so.
Beautiful. I've been talking here with Mrs. Janice Noel Archer as we look at women and their sexual health. And I suppose she is shaking hands with the Apostle Paul, who advises and who has given treatment to even the HPVs and the STDs, the STIs. He says in Romans chapter 13 and verse 14, now put on the Lord Jesus Christ and make not provision for the flesh to fulfill the lust thereof. If you follow this, man, you will be happy, you will be thankful, and you would be able to live freely, live a life that is pleasing to God and even to your life partner. Thank you for taking the time to be with us, and we look forward to having you once again on JC24/7. Thank you too, Mrs. Janelle Noel Archer. Welcome. And see you next time on JC24/7.
Thank you for viewing JC24/7. Be sure to subscribe to our YouTube channel and remember to inspire your living as you prepare for heaven. You can get it all on JC24/7.